and welcome to the Shatkin F.I.R.S.T Monday Morning Minute. Good morning and welcome to the Monday Morning Minute. We're here in Buffalo, New York at the Shatkin F.I.R.S.T Training Center, and this morning I'm here with Dr. Jessica Mansfield from India Atlantic, Florida.
Yes.
I said it right.
Yes.
Okay, good. That's a tricky one. But we're so happy that you're here with us to learn a little bit about mini and mono implants today. So let me ask you this question, Jessica. What was your decision making in coming up to our course? Why do you want to come up?
I decided I wanted to start doing implants at my office, placing them. I've been restoring them forever.
Okay.
But decided I need to stop referring and start placing. And I had heard of mini implants through Gordon Christensen.
Okay.
And that really stuck in my head.
And how long ago did you see Gordon Christensen speak about mini implants?
At least 15 years ago.
At least 15 years. Okay, gotcha.
Yeah, if not longer. And that really stuck in my head. I really like Gordon Christensen, respect his work. And I love the idea of the mini implant being affordable, less invasive, less painful. And
Right.
I decided if I wanted to start placing implants, I wanted to do something that not all the other oral surgeons in my area was doing. Tap and untap market.
That's phenomenal. And those are all excellent ideas and reasons to do it. And yeah, I think what's going to happen is when your patients start to understand that you're doing these mini implants, you'll get an influx of patients coming in for such a minimally invasive procedure. So today we're going to be doing some hands-on with mini and mono implants. You're going to see live surgery tomorrow. Now, did you bring any of your staff members up here with you, or?
I brought my treatment coordinator
Okay.
so that she could understand the difference between traditional implants and the mini and mono implants so that she can talk educatedly to my patients.
That's a great idea. That is an excellent idea. Boy, nobody even told you to do that, did they? You just had that in your head, and that's a great idea. And you're Navy trained, I understand?
I was in the Navy for 7 years as a dentist.
Good for you. Excellent. So, yeah, your patients are going to love this, and we so thank you for coming up to Buffalo.
Thank
And
you.
was the flight bad to get up here? Or?
No, it wasn't bad at all.
Wasn't bad at all. Okay, excellent. Okay, well, here it is. A brand new doctor to our course, and you too should come out and see what we're doing here in Buffalo to learn how to place minimally invasive implants.